This is the medial part of the neck, which we can see the thyroid muscle, carotid artery, the internal jugular vein, sternocleidomastoid, all these anterior scalene. We'll move a little laterally. Middle scalene. In between the scalene muscles, there is the nerve sheath having nerve roots. I have frozen the screen. So this is the C5, C6, and C5, C6, and C7 nerve root. Fine. So what we do, let me find it again. This is the target area, and the needle trajectory is lateral to medial. So we enter from the lateral side, we enter this part of the brachial plexus or the nerve roots, and we give injected here to cover all the three nerve roots. Now we will be performing and demonstrating supraclavicular nerve block, and it will be done by Dr. Umair. Dr. Umair, over to you.
You should have a pillow under the scapula and on one side of the patient's neck, because you want this whole space open and empty for you. Otherwise, your hand will get stuck. You won't be able to needle. And the second very important thing is, either if your patient is awake, ask him to keep his shoulder down so that he's trying to grab his legs or trying to grab his feet, right? And if you don't, you can ask an assistant to pull down the arm so that it's stretched like this, yes? So this entire area is open for you, okay? So this is for the positioning. You should have a nice open space here so that your hand can stay as flat as possible, and you want to drag the hand downwards, all right? You'll palpate the clavicle, right? And you simply place it here. You simply place it down just to top the clavicle in the supraclavicular fossa. See, there's a fossa here, there's a dip over it. You simply place it in the fossa, and then you use the ultrasound to identify the rest. So I'm planting my probe into the supraclavicular fossa. I have no idea what I'm doing. Maybe I'm a bit to the side, maybe I'm a bit to this side. So what I'm going to do is I'm going to sweep around, looking with my ultrasound until I see a big round vessel. Okay, freeze it here. We'll show you the big round vessel. Forget the nerves for now. There is a big round pulsating vessel, all right? So that's going to be the first structure you want to find. Very easy to find. It's round. It has anechoic fluid inside. That's your vessel. Now, as soon as you see the vessel, you'll see that above and just lateral to it, or just to the right side of it, you're going to see a bunch of grapes, or how should we say, a tangle, something different looking, you see. So this whole strip here is your supraclavicular brachial plexus, right? So the thing to notice is that your trunks divide into divisions, and here at this point you're seeing divisions. This is quite a broad area, it's quite a broad plexus, so it's very hard to miss, yes? And the important thing is you find the artery. Now let's open stem. So again, don't know what I'm doing. I just placed the probe, looking around, I found a vessel, okay? So I found a vessel. That vessel I know now is the subclavian artery, okay? And just above and lateral to it, I'm seeing this whole bunch of grapes. Just below it, I'm seeing a very important structure, and that is the first rib. This round black shadow, which is cortex, you can just see. This is the first rib, okay? So it's important that when you're scanning for a block, now if Dr. Jamal can demonstrate, as I tilt upwards, you see the artery's actually gone off the rib. Okay,
Yes.
so this area below that's moving so drastically, that is the pleura. Let me take a deep breath. The pleura is moving. This is the pleura, all right? And just beside it is the first rib. So if I'm scanning, if I just tilt my probe a little bit, you can see that the artery is actually moving up and down. So at this point, the artery is actually above the pleura, not above the first rib. That is dangerous. When you're scanning and you miss, you're going to possibly miss the rib and enter into the pleura. So you don't want that. You adjust until you can see your brachial plexus wonderfully, and you can see that your artery and your plexus are on top of the rib. The important thing about that is that when you are needling, if you mistake your needling, the worst that will happen is that you'll hit bone. And there's nothing wrong with that. You can hit the bone as much as you want, so long as you don't hit any very dangerous structure. Okay? And now, if you want to scan with a bit more finesse, you can follow these same structures upwards. So if you can see the brachial plexus, all you have to do is keep an eye on it and just follow it upwards slowly. Now there is a structure here, this round structure. This is your superior trunk. This has not divided yet. This is your superior trunk. Okay, and just a bit infero-medial to it. If you can see it, it's the middle trunk. Yes, this is your middle trunk. Okay, and just infero-medial to that, towards the artery, there's also a little segment. That's your inferior trunk. So you can see all three trunks in a line over here. As soon as you go down, these trunks start to divide into divisions. You can see it very clearly. If I go slowly, this is the trunk. Yes, excellent. This is the trunk. Watch these trunks as you go down. They start to split apart. Into different pieces. And now they've become the divisions just atop the first rib, right alongside this. And a very easy way to do an interscalene block is, if you find the supraclavicular brachial plexus, just follow it upwards. Just follow it upwards. And here you go. You will see between the two muscles, the middle scalene and the anterior scalene, you will easily be able to see the interscalene area as well. So these two blocks are very significantly connected to each other. If you know one, you will know the other. Okay, and I think that's it for this class.